Alcohol is deeply woven into many cultures and social gatherings. It's often seen as a way to relax, celebrate, or connect with others. But growing scientific evidence is revealing a troubling connection between alcohol and cancer. Recently, U.S. Surgeon General Dr. Vivek Murthy issued a significant warning about this link. He urged the public to rethink their drinking habits and understand the serious health risks involved. Research has now confirmed that alcohol is linked to at least 7 types of cancer. These include cancers of the breast, liver, colon, mouth, throat, esophagus, and voice box. Importantly, the risk isn't tied to the type of alcohol, whether it's beer, wine, or liquor. Instead, it depends on how much you drink. The more alcohol you consume, the higher your risk of developing cancer. According to the World Health Organization 2021, alcohol is a major contributor to the global cancer burden, with studies from institutions like Oxford University reinforcing this finding. To understand why alcohol is so harmful, we need to look at what happens inside the body. When you drink alcohol, your liver breaks it down into a toxic chemical called acetaldehyde. This substance can damage your DNA, leading to mutations that may trigger cancer. Alcohol also produces free radicals, unstable molecules that further harm cells and DNA. Additionally, alcohol can disrupt hormone levels. For example, it raises estrogen, which is a known risk factor for breast cancer. At the same time, alcohol depletes essential nutrients like folate and B vitamins, which are crucial for repairing DNA and maintaining healthy cells, as highlighted by the National Cancer Institute, 2021. Consider this. Research from the American Institute for Cancer Research, 2020, shows that a woman who drinks 1 glass of wine a day increases her risk of breast cancer by 7 to 10%. For those who drink 3 or more glasses, the risk jumps to 20%. These numbers highlight how even small amounts of alcohol can have a big impact. Women face a higher risk of alcohol-related cancers compared to men. This is because women's bodies process alcohol differently. Even small amounts of alcohol can significantly increase a woman's risk of breast cancer. For men, the risk is lower but still concerning. Drinking just 2 alcoholic beverages a day can raise the likelihood of cancer for both men and women, according to the American Cancer Society, 2022. For years, many people believed that moderate drinking, especially red wine, could be good for the heart. However, new research has challenged this idea. While moderate drinking might have some heart benefits, it also increases the risk of several cancers, including breast and liver cancer. As Dr. Otis Brawley, an oncologist at Johns Hopkins University, emphasizes, no amount of alcohol is entirely safe when it comes to cancer risk. Even light drinking carries some danger, Brawley 2021. A 2021 study published in The Lancet revealed that alcohol was responsible for 741,000 new cancer cases worldwide in 2020 alone. This staggering number underscores the global scale of the problem and the urgent need for action. In response to these findings, the Surgeon General's advisory calls for stronger public health measures. One key recommendation is to update warning labels on alcoholic beverages. Current labels, introduced in 1988, focus on risks like impaired driving and pregnancy but don't mention cancer. Clearer, more prominent warnings could help people make informed decisions about their drinking. Public awareness campaigns are also essential to educate people about the cancer risks tied to alcohol. Doctors and healthcare providers can play a critical role by discussing these risks with patients, especially those with a family history of cancer, as noted in the 2023 Surgeon General's report. Governments can take additional steps to reduce alcohol-related harm. For example, raising taxes on alcohol could discourage excessive drinking, similar to how higher taxes have reduced smoking rates. Limiting alcohol advertising, particularly to young people, could also help. These measures, combined with public education, could significantly lower the number of alcohol-related cancer cases, according to the World Health Organization, 2020. In countries like France and Australia, stricter alcohol policies have already shown promising results. For instance, France's Loi Evan law restricts alcohol advertising and requires health warnings on bottles. As reported in the European Journal of Public Health 2019, this has led to a decline in alcohol consumption and increased public awareness of its risks. If you drink alcohol, there are steps you can take to protect your health. Reducing your alcohol intake is one of the most effective ways to lower your cancer risk. Even small changes like drinking less frequently or choosing smaller servings can make a difference. Non-alcoholic alternatives, such as mocktails or alcohol-free beer and wine, are becoming more popular and widely available. Talking to your doctor about your drinking habits is another important step, especially if you have a family history of cancer, as recommended by the American Cancer Society, 2022. The problem of alcohol-related cancer isn't limited to the United States. Globally, alcohol is responsible for 3 million deaths each year, according to the World Health Organization, 2021. It's a leading risk factor for diseases, including cancer. Even one drink a day can increase the risk of breast cancer by 7 to 10%, as reported by the American Institute for Cancer Research, 2020. This makes alcohol a major public health challenge worldwide. In low and middle-income countries, where alcohol consumption is rising, the impact is even more severe. Limited access to healthcare and education means many people are unaware of the risks. For example, in regions like Sub-Saharan Africa and Southeast Asia, alcohol-related cancers are on the rise, yet public health resources to address the issue remain scarce, as highlighted in the 2020 Global Burden of Disease study. Addressing this issue requires global cooperation and targeted interventions. The Surgeon General's warning is a wake-up call for individuals and policymakers alike. By drinking less, spreading awareness, and supporting stronger public health measures, we can reduce the burden of alcohol-related cancers. Just as past efforts changed how society views smoking, this advisory has the potential to reshape how we think about alcohol. Making healthier choices today can lead to a safer, cancer-free future for everyone. Remember, every small step counts. Whether it's choosing a non-alcoholic drink at a party or talking to a loved one about the risks, your actions matter. Together, we can create a healthier world for ourselves and future generations.